Thank you, Daniel. Thanks for the invitation. Before I start, I think we share this vision. I think we share the vision that you have laid out here, and I think we want to be part of working us towards implementing this vision, which is challenging. It's a vision that I think we see in quite a number of countries. The challenges are similar, quite nuanced in certain areas in Greece. No doubt, we do live in turbulent times. I think you mentioned and we heard about the geopolitical trends that deserve innovative answers. I think the answers of yesterday will not really address what we have in front of us. At the same time, there are exciting technological opportunities. We heard about AI specifically. They not only help us as private sector or the public sector to innovate, but I think they also carry enormous opportunities for patients, for how patients engage with the healthcare system, but also for empowering patients to approach the healthcare system with a certain demand for technological and other solutions for their challenges. Let me highlight three areas, and we heard a little bit from Albert Bohler about those. You look at the pipeline, for example, the pipeline of my company, you have a wide range of innovative medicines, but also other technologies that really need to work together to deliver the envisaged outcomes. Think of patients with rare diseases. Think of cell and gene therapy, which really offer opportunities potentially of curative outcomes here. Think of cancer medicines. Think of precision oncology in this space. I think we've achieved a lot in the past and will, based on a strong foundation, also a strong technological foundation, achieve more. I think then there are certainly there is this link to specific capabilities within the healthcare system. Without those, it's impossible to deliver the outcomes. So it can deliver on its own. I think you mentioned the access to molecular testing or to new testing opportunities. Genomic sequencing is an important foundational element of delivering these therapies. And then, of course, when you look at the geography of Greece, I think what comes to mind is the burden and cost to seek and get access to care. So this geography, I think, seems to be an important platform for tools and innovation like telehealth, telemedicine, and a new engagement for patients. I mentioned the need for combined technologies specifically. At the same time, there are fundamental challenges in the healthcare system, largely driven by an aging population. So these are many more patients on one hand. It's just a much larger number of people, often with more chronic conditions that seek care at the same time. These are patients that grow into, or that are grown up and ultimately have probably also quite different expectations from the healthcare systems. And then I think there is a fundamental challenge here, and that's workforce shortages. It's the shortage of workforce to deliver care that all systems have to prepare for, and it has to do with the same topic, the changing demography. We talk a lot about sustainability. I think it's important. We need to grow healthcare systems in a sustainable manner. Sustainable manner for all participants. I think certainly also for industry and other sectors and other parts that are actively contributors to the healthcare ecosystem. In this sense, I think standing still is clearly not an option. It looks sustainable if you stand still and try to maintain. I think we need to evolve and we need to create these correlated complementary capabilities of the healthcare system to fully embrace technology and innovation. Innovation not only comes in the form of new outcomes, new opportunities, but I think also there has to happen a lot from within the health system in terms of process innovation, how we deliver care. So how do we bring this all together? I think there's just 4 areas probably that I highlight. We may have a chance to go to this more in detail. I think you mentioned the need to address the structurally underfunding of the healthcare system. When you compare Greece with the rest of Europe, I think per capita expenditure is less than half of that of the average in Europe. When you think of the accessibility of drugs, out of the 160 drugs that were newly approved in Europe during the last 4 years, about half are accessible in Greece, which is an average position. But certainly, I think there is an ambition to reach for a higher level. I think we need to address inefficiency in healthcare systems. The OECD considers this a major source to also reallocate and fund innovation. I think we heard a lot about HTA, horizon scanning, the opportunity of a new way to assess in a collaborative manner health technologies to allow an earlier start for the adoption of health technology. I think a specific challenge here for us is the idea to wait for 5 other countries that first have to positively decide before the process can reach a certain stage in Greece. I think that's something that the European Union wants to overcome with the EU HTA regulation. Same starting point, very early for the adoption. And maybe my last point here, I think we need not only our innovation, the innovation of the industry, of companies like Roche or Pfizer. It needs also that we unlock the innovative potential from within the healthcare system. We need the many people, the many individuals in the system to reconfigure how outcomes, how healthcare is delivered. We need their capacity to be part of this. And I think together with the private sector, we can introduce and use reforms that will ultimately help to realize efficiency in care. And I mentioned this, Roche, this innovative industry wants to be part of this surge journey.